just talk with some folks that have been on the calls today. And we've seen so many of you in the comments section has just been lit on fire, which I love to see with some amazing comments. And so, but I wanted to talk with a few folks that I know that I believe are on the call now. So I'll just call them up and then you guys can spotlight these folks as well. Tara Corey, Elizabeth Eubanks, and Martin Addy. I know I've seen some of y'all's comments in the comments section today. Martin, it's great to see you. Tara, great to see you as well. And I think Elizabeth's going to be joining us in just a minute. But Martin, since you're right here on the right of my screen, I'd love to hear just your feedback from today. How have you enjoyed the sessions? How has it kind of been for you listening to some of these speakers today?
Well, thank you, Jonathan, for the opportunity. Sitting in the meeting today, and then after Susie texted me earlier in the day and asked if I would stay on and talk a little bit, that really made me feel noticed. But in one of the meetings earlier in the day, I've been sharing a lot in the chat room and different things, and somebody reached out and said that I always learn something when you're here. And referring to me, and it's like, well, I didn't think I was saying that much. But in another place we talked about the ripple effect, that we have an opportunity in our lives to help other people and to do things. And I've tried to work on that over years. I've been involved in the hemophilia community at different levels. But I wanted to point out a couple of things I really saw today in the chats, because they were very, very busy. Sometimes they were hard to keep up with. And you'd be
I
looking
can't
at one
read
and
that
six more
fast.
pop up. But one of the things that I saw was a growing community. We had new people coming in, some of them with names that they might be from other countries, perhaps,
Hmm.
or new to our country. And that's very encouraging to me. I felt like we were lifting each other up. I felt very encouraged from the different speakers. One of the things was, live our best lives. I felt like the day was really therapeutic in a lot of ways. That a lot of thoughts uh, I agreed with so many things that different speakers says that I've went through in my own lifetimes of depression as a kid, because life was hard when I was a teenager. Back in the early 70s, you know, factor if you were in bad shape. Before that, whole blood or plasma if you were about to die, those kind of things. The 80s sucked with HIV and all that, which I was a benefit of, but I'm still here. Probably the hardest part was in 87 when the doctors told me and my younger brother that we both had it. And they said, you got 3 to 5 years, you better make plans if you got things you want to do. But I felt like the Lord has pointed us in a different direction. We're still here doing stuff.
So
You know,
good.
one of the other, one of the other things I really love, the focus of your company, that just in the name of it, about hope,
Mm.
not to give up. Just to hang in there, even when times are tough. We can lift each other up. We can be supportive. It was mentioned that it shouldn't be shame or fear, but love and support.
Yes.
And I think that's a wonderful way to have a day. I feel really lifted up, and I'm looking forward to hearing Andy tomorrow, because it'll be interesting, because he and I spoke together at an HFA meeting back in 2011 in Indiana when I was talking about insurance stuff. And I made the joke at the beginning that they should be happy that even though I was a preacher, I didn't expand to give them a whole sermon, but it was kind of a long talk.
Oh, that's incredible. I didn't know that you were a preacher before, but man, that is wonderful. I love that. And I have to say I've seen we've interacted some at some of these meetings before as well. And man, you really could not. So many people just even as you were talking was saying, man, I've learned so much from Martin in the comments, and I just appreciate so much. All that you've brought, the encouragement, everything. It's just so much love coming in the comments for you, Martin, and I just appreciate you being here. I appreciate you cultivating that same culture, like you said. It is intentional that we
Mhm.
want to be inspiring, that we want to be life giving, we want to be able to cultivate a sense of real support. A lot of times I'll say things like this it's community alone is not the answer.
Mm,
Healthy community is. I think you can
right.
have a community that can be sort of toxic too. And so we've really
Mhm.
put that, that's kind of like you said in the name, we're trying to actually cultivate a supportive community, one that's like really supporting each other. And you're a huge part of that, Martin. And I really do appreciate your contribution to not just, just giving your story, but also giving your wisdom and your encouragement along the way. Cause we definitely feel your presence and you are seen for sure. So thank you so much for your feedback. So good. Well, Tara, I'd love to hear from you. I know I've seen your some of your comments in the comment section too. How has today been for you? How's the sessions been for you today?
Just reassuring we're not alone.
Hmm.
Being in rural America, being 175 miles one way from our HTC center, being a girl, period. Me and a journey story is just crazy from having major surgery and them not knowing what was going on with me and everything being so much longer and bleeding and they didn't know what to do. And then she starts her 13-year-old journey to life as womanhood, and her life is just have totally turned upside down. And then her finding out, to me finding out now, and then having just two terrible accidents back to back in the last 30 days. Kevin gave me so much hope that things are going to be okay.
Hmm.
So thank you guys. Thank you for introducing me to this. Thank you to everyone that's done everything today. We take away so much, and you just have to. Like one of the girls I was talking to, it takes you like a week or so just to kind of consume and the positivity, the family we know we have, that we're not alone, and just keep pushing and advocating because they're eventually going to figure my medicine out. I've
Hmm.
taken huge steps to get it to University of Wisconsin now, finally. So thank the Lord for that.
Yes, that's so good. That's so good, Tara. I know it's been a hard road, and I love what you said about not being alone. We kind of have that as a tagline or a mantra that we use a lot around here, and I see a lot of nonprofits out there that have that kind of messaging, but it we really haven't found any other better way to say it. I mean, we just need each other, and to be able to just sometimes just know that it can feel so isolating when you're fighting those struggles with insurance and the hospitals and all the different things, and you just feel like you're literally the only one going through it, and to know that you're in the middle of this fight, and there's people that maybe states away and like all the way across the country that are kind of going through similar things. It's like we just need each other. And so I appreciate you saying that.
And I think that's one of the biggest things. No matter how many miles apart we are from ocean to ocean, world to world, this community is always here. Like I have
Mm.
people all over the United States now, just checking on each other, and it's just crazy. It's just so I don't even know what the words to use to describe it for since January with us. We're so new to this, and it's just we're gonna be okay.
So
So
good.
thank you to everyone.
So good, Tara. We're here for you. You got a whole community, like you said, all rooting for you for sure. Elizabeth, I have seen some of your comments and heard some of your stories. So heart wrenching, and love to just to hear your thoughts. I know you've been through a lot too, and just curious, just as far as just today's sessions, like what kind of impact has this had on you today, and how are you feeling about things today?
Oh my God, this community has given me so much, and I seen like message from somebody's like their first, this is their first conference, and I remember my first conference, and you never feel judged and hope. You can ask questions even if they sound crazy. Just people in this community like make you feel like you're not the only one, and like Tara said, like perfectly, like you're just so supported, and the outreach and, talking like ideas I didn't even think of. Like somebody put in there about, started a daily journal, just a thought. I was like, oh my God, I'm gonna talk to my son. It's like, and then like there's some gentlemen in a group and we were going back and forth and talking about like mental health in the community is like just it's heartbreaking. And I've just been dealing with my son and I'm like in between generations. Like my brother was in bad blood and like dealing with him and his mental health. But like for him, it's not bleeds, it's the AIDS portion and like
Right.
helping him and like trying to get him to be a part of this community. And but like mental health is so hard. And I've been trying to focus on my own son. And I went to orthopedic for myself, but like listening to these women in the group and having like for myself not been officially like tested and like having my hips replaced when I was 36 and having orthopedic literally tell me it's like, oh my God, you have so much joint damage for being such a young person. Why have you never been tested? It's like, I don't know, because I'm like, I've always been told this is a man's disorder. But like seeing all the women in these meetings and talking about, and they're still advocating for themselves even though you can be tested, like seeing them pushing like for more medicine. And it's just empowering. And like I officially have an appointment like after all these years for myself and my son Friday. And I'm just like, I feel like honestly I wouldn't even got to this point if it wasn't so women in this community that you guys provide a forum and just foster so much like support is just amazing. Really, truly amazing.
Well, thank you for saying that, Elizabeth. But it really is your story that drives us forward. I mean, we've not only lived it, but we've also just listened to the stories over and over and over again of people throughout the community that are facing just those same type of things. But I'd love to talk to you more. I feel that way about just about everyone in the chat. I literally want to be like, can I just sit down and have lunch with every single person in here? But I already need to lose weight, so that's probably not a good idea. But I just think that there's so much here of depth. Like every single person, you look at like the call like this right now. There's 84 people, on this call with us right now, and you just think about every single one of these people have an incredible story, so much depth, experience, but also so much pain and trauma and trials. And so, these stories and your story is what really drives us forward. And so, thank you for your vulnerability. Thank you for your willingness to be a part of this community and to invest in these moments like this, because we really do this for all of us. I mean, it's kind of, we are family in a sense. Like we have to stick together, and I don't want to see anyone to feel like that they are alone at all. And I do think as an organization, it's important for you to know, which I think you do, and I think so many people know, is that we're here 5 days, 7 days a week sometimes, but we're here all the time advocating for people day in and day out. And so when people are going through stuff, I mean, I believe in a future. I believe in a potential of a day where women will not have to have joint replacements in their 20s and 30s because they're getting diagnosed right at the very time that anyone is diagnosed in their family. You may have seen, I did a podcast interview with Dr. Akshat Jain from California just recently, and he talked about this in the podcast episode, that he said, in sickle cell right now, that patients are literally, when they identify one patient, they test the whole family, and everyone gets tested, and they basically look for the genetic mutation, and if they have the mutation, they immediately come in as a patient. They don't come in looking for levels of what severity you are and all that stuff. You just have a mutation, you get diagnosed, and then the levels actually dictate whether or not you get therapy or not. And he was talking about how important it is. We've got to move to that for women broadly in the bleeding disorders community, and it's going to take a lot of time, but I think that timeline gets shortened up for the more people that like you that are willing to share your story and share your experience, because that's what's actually going to change the narrative, I think, for the whole community. So I'm sorry that you've had to go through so much, and I agree the mental health piece of it is so difficult, but thank you for being here, and thank you for sharing that. Really appreciate you. I've got a newcomer, it looks like, that I'd like to call on to is Jarrett Sturrett. If I'm saying that right, I might be saying that wrong, but Jarrett, are you here? Are you on the call right now?
It's Joshua.
I'm sorry. Did I read that wrong?
Sorry.
Joshua, my eyes are failing me. I'm so sorry.
Oh, it's fine. Can you guys hear me?
Yeah, we can hear you.
I've been listening all day. I'm actually getting choked up. I thought I wasn't gonna cry when I was gonna talk, but I'm gonna try to make this quick. I know everybody's from different parts of the country. When I got on this call, and I gotta be perfectly honest, I'm a black man, 40 years old, hemophilia A. And when I got on this call, when Joe from Hemophilia reached out to me, I'm looking at you right now, man. You're a big, 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 big thank you. He just told me like it's gonna be some gift cards. And I was like, well, that's cool. Let me just listen in. It's not gonna be a lot of people. Let me just and just hearing people's stories and looking in the chat. And I couldn't get on video today because I work from home and I've been working. I want to, respect my job. But
Sure.
I just scroll up and scrolling and seeing these videos and seeing you guys' faces, and then I see these black people in here, and it's like, I mean, and I'm not trying to make this about race or anything, but as a black person, we don't see a lot of black people to show up to these meetings, so it's good to just know everybody's here and everybody's trying to help each other, and I just want to say I really appreciate. I don't even cry a lot, and I got kids. I got to be tough for the kids and stuff, but like it's like I'm so happy that I joined and I'm a part of this group because it was very, very, very helpful today. And I'm gonna come back tomorrow and I'm gonna listen. Hopefully I could share a little more. But I just want to say as a first time listener or a first time coming to this and understanding what this is about, this is actual community. This is actual community. I told the lady that I wasn't gonna be long, but I just wanted to say that. I just want to say I really had a good time today. I stayed for every last meeting, and I really appreciate everybody's stories and reading the chats. You guys have a good night.
Thank you so much, Joshua. You can make me tear up. Oh my goodness. Thank you so much for saying that. Really, what a blessing. Wow.
Yeah, Jonathan, thank you guys. Like you guys, it's been hard to hold back tears today. Thank you.
Absolutely. Thank you.
Jonathan,
You guys rock. Keep on pushing.
Thank you. Martin, I hear you had something there too. I'd love to hear you.
Yeah, I was just going to make a plug, if you don't mind, for NAMI. If you're familiar with that, the National Alliance for Mental Illness. I've heard a
Yeah.
lot of comments and seen a lot in the chats today about mental illness, and I'll just share a moment. Our daughter's going to be 40 in July, and when
Mm,
she was 15, she started having issues with bipolar, and it has just been one of the hardest roads of my life, more hard than my hemophilia at times. But NAMI has been a great resource for us because we knew absolutely nothing about mental health care. And we started going to the family support groups there. I'm a co-facilitator in those family support groups because of what we learned. It's like we have a couple of communities. I've got a hemophilia community, I've got a mental health community, I've got a church community, and they all need love and support to keep them
mhm.
flourishing. And if anybody is not familiar with NAMI and you have some issues in your family, if you have a loved one that has mental illness and you're having difficulty dealing with that or needs some support, they if you can find a NAMI close to you, they have family support groups. It's called Family to Family, usually monthly. Some places it's twice a month. Some places are virtual. You don't have to even get out of your home. Just depends on where you live.
So good. Thank you, Martin. Yeah, we just posted the link in the chat as well, so you can click right there and find out more about groups in your area. That's such a great resource. Thank you so much, Martin, for mentioning that. So good. So good. Goodness gracious. I might have to have somebody else finish this. I'm still soaking on all these comments myself, but man, thank you all so much for your feedback and thank you for being really just who you are and contributing to the conversation like you have. I really believe, a friend of mine used to say all the time that there should be no decisions about us without us. And it is really in our desire as an organization, as a group, as a family, really, that we could cultivate a strong organization and community of really vigilant patient advocates that can really articulate the challenges that we all face day in and day out. And the reason why that's important is because so often we end up sort of at the end of the food chain, if you will, when it comes to decision making. A lot of times doctors clinicians, a lot of times the industry that makes the medications, as well as policy makers from DC and Washington, as well as to state level legislative offices. They listen to a lot of the people that are lobbying for their attention and their dollars, like in the insurance companies and the formulary issues that are faced there. And so if we don't organize as a patient community, and if we don't talk about our challenges and support each other, that's just the starting point for where we can get really organize some of these issues and start to really advocate for long-term and effective change that really can be meaningful to communities for our community down the road. And so it's really important that we do this for each other, but it's also important for us as we continue to cultivate a sense of really defending our rights as patient advocates. So thank you so much for all of your contribution. Thank you for every single message that you put in the chat. That does not go unseen. That is something that we really cherish about, these moments like this, and really collectively just the love and care that we see in there. This is what drives us. I think all of us around here at Hope, we get up every day looking forward to the next moment we get to do one of these events, because it's just so driving for so much of our opportunity to serve each other and to cultivate a sense of friendship and passion for each other. So I can't say thank you enough, but I really do appreciate all of you being here and being a part of this community that we call Hope. And I know for Joshua, I certainly hope that you're a lifer, and then we can get to know each other a lot better. Thank you for carving out time. I also want to just say thank you for being vulnerable and honest too about just your concern of not seeing diversity. This is something that we're passionate about, and I know I'm just a middle-aged white dude, so forgive me for not representing all the spectrum of the patient population, but it's super important to us. That's a sensitive topic. I know you mentioned it as being kind of sensitive, but it is crazy important to us that we have every voice represented in every way that we possibly can that's meaningful to the betterment of our community, and that we're focused on these things to be completely inclusive and to not be exclusive in whatever ways that we can. So those things are meaningful to us, and we really, really sincerely appreciate every person's voice and every person's contribution. So thank you all. I know